Thank you for inviting me to be here tonight with you. Congratulations on 30 years. That's pretty exciting. 30 years for the people, coalition of people. So I wanted to talk a little bit about how I got involved in single-payer work, where that path kind of took me, and how I ended up spending 2 months living on Freedom Plaza in Washington, D.C., and where I kind of think we need to go from here. And I'm going to try not to talk too long because I really want to save time for questions and hear what you want to talk about. But I am a pediatrician. I practiced for 15 years, and during that time became increasingly frustrated at the way medicine is delivered in this country and the pressures that are put on us, especially primary care physicians, to see more and more patients, spend less time with them, fight with insurance companies. It's not about health. Our healthcare system is designed to create profit for the industries like pharmaceutical and private insurance and hospital corporations, and not create a healthy society. So I got involved with advocacy and ultimately decided to leave practice and do the advocacy work full time because I didn't like the pressures of how to practice here. I got involved at the state level, and then, as Mary said, when the health reform bill came to the federal level, got involved there. I was part of a coalition called the Leadership Conference for Guaranteed Healthcare. We were doctors, nurses, faith-based groups, community groups, unions. We represented 20 million people nationwide. And we started meeting with members of Congress actually in December of 2008 in preparation, and just saying, very simply, when you start debating or going over these health bills in committee, just compare single payer to what you're putting together on two standards: how many people are covered and how much it will cost. Because we know that single payer is universal, everybody in, nobody out. And we know that we can provide lifelong, high-quality, comprehensive health care in this country to every single person, and do it for the same amount of money that we're spending right now or less. When we got to the first set of committee hearings, that was the Senate Finance Committee. Max Baucus is the chair of that. And we requested to have one of the members of Physicians for National Health Program, who's a national expert on health finance, testify. And they said no. And we said, really? Okay. So then we started a campaign to have people who had senators on that committee from around the country to call in and say, invite a single payer representative to testify before the committee. And as it came down to that second hearing, and we were calling the committee routinely to find out whether we were going to be able to have someone testify, the Monday, the day before the hearing, the final word was no. No more invitations will be given. So at that point, we were kind of at a wall. Like, are we going to just give up? This is the first committee, and they're not even letting us in the door. Or are we going to do something about it? And that's when 8 of us went to that committee: 3 physicians, 2 lawyers, Kevin, my partner, was one of them, and 3 health advocates. One was with labor, one was with Healthcare for the Homeless, and one was the national coordinator of Healthcare Now. We went to the committee and we stood up one by one and said, why aren't you allowing single payer to be listened to in this committee? And we were each arrested for doing so. So that was kind of the first time that I experienced what I now call civilized disobedience, and the power of that and the need for that. And throughout that reform process, we pushed at every avenue that we could. We brought in lobbyists. We held congressional briefings to educate about single payer. We educated the health liaisons about single payer. We testified in the committees after that, but it didn't really make a difference. I mean, it did in the sense that we got 2 amendments, one in the House and one in the Senate, that would have actually substituted a single payer bill for what they were putting together. The House one was withdrawn from the floor 36 hours before the vote, and the Senate one did actually make it to the floor of the Senate. Bernie Sanders was the one who introduced that, and it was killed by Dr. Tom Coburn from Oklahoma, a senator, who used a maneuver to basically kill that effort. But it was the first time single payer ever made it to the floor in either house, so that was pretty exciting. But I came out of that experience with kind of 3 things that I saw that we needed to do if we wanted to get single payer in this country. And they have the acronym, actually, ICU. So, if we're in a crisis, we need the ICU. And the I stands for independent. That if we want to get single payer, we need to be, as an issue-based movement, independent of political party. because the health bill that was passed suddenly stopped being about a health bill and started being about President Obama's reputation. And the members of Congress who voted for it admitted that. So many of them told me, I'm holding my nose and voting for this bill. And I said, well, tell that to the people that are dying or losing their homes because they can't afford health care. Because this is not about President Obama. This is about real lives, real people. The second is clear. We have to be extremely clear on what it is that we want, because they use all this rhetoric to fool us. So after the bill passed, members of Congress were going home and calling it universal, affordable, guaranteed health care. It's none of those things. It's designed to leave tens of millions of people out if it's fully implemented. It's not going to control our health care costs, which are the prime cause of one of the prime drivers of our economic problems in this country. And it's not guaranteed, because private insurance in this country does not guarantee that people can get the health care that they need. The leading cause of bankruptcy, more than 62% of bankruptcies, are from medical costs, and 80% of the people that go bankrupt had health insurance. But then they suddenly find out that they, through their deductibles and their co-pays or things that are not covered or not in network, that they can't afford the care that they need. So we have to be clear about what is universal, affordable, guaranteed care and what is not. And the third is we have to be uncompromising. For too long, we've been accepting what we're given because we're told that's all that we can get. You know, we accept these little compromises. It's interesting to see people go through this who are new to the movement, because you get caught up in this, well, but this Medicaid expansion is going to give more care to more people. Well, Medicaid is not the best type of care. It's difficult to get good care under Medicaid. But what about all the other people that are still left out? We have to be thinking about those people too, and say, no, every person in this country deserves the medical care that they need. So I was traveling around the country and speaking about single payer and kind of what do we do now, and working with chapters on next steps. And people kept saying, well, what do we really have to do to get single payer? And it just became clear that what we needed to do was see single payer as part of the broader struggle for social and economic justice. And that each of us that advocate for economic justice, for environmental justice, for peace, run into the same obstacles. And that's the corporate control of our political process and the corporate control of our media message. So what if we actually banded together in a broad-based, independent, nonviolent movement and demanded the changes that we need? And so my first opportunity to actually kind of walk the walk of what I was talking was in December of 2010, when I was invited. A friend was going to go get arrested in front of the White House with an anti-war action. And he asked me to do his jail support, and I said yes, and then I thought about it, and I said, wait a second, I want to go and stand with the Veterans for Peace and the others and show what it means for movements to stand together in solidarity. And so I did, and they were kind enough to invite me to speak at the press conference and to be kind of one of their featured of the 131 of us that were arrested. I got to stand with Dan Ellsberg and Ray McGovern and Chris Hedges, and so that was it was a great opportunity to actually link these two things together and talk about how it's empire, it's that all of our money is going to military spending instead of meeting our domestic needs, that if we actually want a healthy population, we have to address these issues of violence, these issues of not having adequate education, housing, jobs, so many things are all connected together. So after that action where it was serendipitous that we were actually standing out in front of the White House on a Thursday afternoon while the president was inside giving his report on Afghanistan. That was not intentional. They didn't know when they organized the protest that it would be coincidental. And the president was inside the White House talking about how much progress we were making in Afghanistan. But it made no news despite that. Despite that notable people were arrested, 131 were there, it was snowing, it was freezing. So we were meeting after that, and I was very impressed by the Veterans for Peace because they have a deep commitment to change in this country. We were saying, we don't want to do symbolic actions anymore. These things are not working. They don't make a difference. Lobbying doesn't make a difference. We've elected people that are supposed to stand for these policies, and that didn't make a difference. Email campaigns and petitions make people feel good, but they don't make real change. So what do? We need to be strategic and intentional about how are we going to get these changes in this country. And that's when we started actually with an action in New York in April of 2011, where we brought together 17 different groups that advocated for all across the board different issues, and organized a concert and a protest in Union Square Park. And immediately following that brief concert rally, there were hundreds of us, went across the street to the Bank of America and shut it down. We had a picket going outside, hundreds of people. It was on tax day, and they're chanting, "We pay our taxes, why don't you?" And we made cardboard boxes that looked like what we wanted our money to go to. We had like child care, and we had education and public libraries and single-payer health care and green jobs and all this. And we, 5 of us were going to go into the bank and set up our town of what we wanted the dollars to go for, that the government was allowing Bank of America to have as a tax refund instead of putting them into our needs. And it was a risk arrest situation, so it was just going to be the 5 of us. And when we entered the door, like 50 or so people followed us, and we filled the lobby of the Bank of America, and people were in there playing guitar, we were singing, we gave speeches, the police were laughing, they didn't know what to do with us. And so we did that for a while, and then, bankers' hours were over, we left, and we went home, and it was such a high energy thing. We said, well, we need to do this again, but on a much broader scale, on a national scale. And we were inspired by what was happening in Wisconsin, because we went out to Wisconsin and met with the organizers during the occupation of their capital. We were inspired by what was happening in Egypt. A number of our organizers had actually been in Tahrir Square. And then in May, actually, with the Spanish, what happened in Spain was very exciting too. But we decided in April that we were going to do an occupation of Freedom Plaza in Washington, D.C., that we were going to do it on October 6th because that was the anniversary of the beginning of the 11th year in Afghanistan, but it was also the first week of the federal budget, which was unlimited spending for national security state, but austerity budget for everything else. And we wanted to link the issues together of military, our American empire, and austerity measures at home. And so we went public with our website on June. And we saw this, we did a lot, it kind of actually grew. As soon as we decided that was what we wanted to do and we started talking to other activists, we found that everybody was having the same conversation. They were all saying, what we're doing isn't working and we need to find something different. And so it was very quick that groups were signing on, individuals were signing on, and people were signing on to help with the organizing. So it was a national group that actually organized that action. We did a lot of searching of what are we about, how do we actually change power in this country, and we studied a number of things, but primarily we really liked the materials at the Albert Einstein Institute. If you're familiar with Gene Sharp, he writes From Dictatorship to Democracy, and then Robert Helvey there writes a book called On Strategic Nonviolent Conflict. And so we really kind of spent, it was a full-time job for 6 months organizing the occupation of Freedom Plaza, because we wanted to be really clear. We put on our website human need, not corporate greed, as kind of like that's the bottom line. Kevin wrote a great article called We Stand with the Majority, where he looked at polling data and found that supermajorities of Americans already agree on 7 key areas, things like bringing our troops home, ending corporate welfare, getting money out of politics, workers' rights, developing a green economy, single payer, all of these things that Congress is going in the opposite direction. We already have supermajorities of Americans that we wanted people to believe that we don't look to leaders anymore for our solutions. We have to start creating these solutions. So we actually called the action Stop the Machine, Create a New World, because we wanted to combine both protest and resistance to elevate the issues and creating these alternative models that we would like to see replace what's going on. When Occupy Wall Street was announced in July, we were really excited about that. We immediately sent them a statement of support, and within a few weeks, U.S. Days of Rage, who was kind of the organizing body at that point, and ourselves, we called ourselves October 2011, we wrote a joint letter of solidarity. Some of our organizers were attending the meetings up in Occupy Wall Street, and it was interesting because we didn't know, Was Occupy Wall Street going to be the one? Was DC going to be the one? And we just figured whichever one was the one would be a great thing. And never dreamed that by the time we set up camp in Freedom Plaza, there would also already be a national Occupy movement going on. So that was really tremendous. And I understand that you had an occupation here that just, the physical occupation just closed. I think it's really important to remember that the physical occupation was important. We saw that actually as an initial tactic. The Spanish warned us not to occupy for more than 2 weeks, but there was so much energy around holding those physical spaces that nobody was going to listen to closing up camp in 2 weeks. But we really achieved some changes. We changed the national dialogue. Suddenly people started talking about, I mean, when I say we, I mean the whole Occupy movement, changed the national dialogue to talk about wealth inequality. And to be honest, when it comes down to health, wealth inequality is the greatest problem for our health of our nation. There's a great book called The Spirit Level, where some researchers went through and looked at nations and compared them on their degrees of wealth inequality and indicators of social well-being. And the United States is an outlier on almost every indicator. We're just not doing well at all. We're one of the 4 top nations in the world in terms of the greatest wealth inequality. Anyway, I'm getting off track. So we changed the dialogue. We also did have some effect on policy. People kept saying, well, you're supposed to have a demand. Well, we knew from our reading from Albert Einstein, you can't make a demand until you've achieved a certain level of power. Because if you make a demand without the power to back it, you're going to end up, if you get anything, getting less than what you asked for. And we can't go there. So there was no specific demand, but the Super Committee in DC, as you probably are familiar with the Super Committee, it was 12 members of Congress who were given the extraordinary power to write what the budget was going to be, and it was supposed to be going to the floor for just an up or down vote with, it was a complete subversion of our democratic process. No amendments, no debate, just vote up or down. And they were talking about cutting Social Security and Medicare, things that have nothing to do with our deficit. They're self-funded. And for the first time, we had a Democrat president saying that he was willing to cut Social Security and Medicare. Well, that was actually, had a whole campaign focused on the Super Committee. We did protests outside the committee. People walked all the way from Occupy Wall Street to Occupy Philly to Occupy Baltimore, specifically to protest the Super Committee. Leah Bolger, who's now the president of Veterans for Peace, was with us on Freedom Plaza, one of the organizers. She actually went into the Super Committee hearing, went up into the well and stood face to face with the members of the committee and said, you guys are all fraudulent. We know how to fix the deficit. We need to stop the wars. We need to tax the rich. It's that simple. And she just had her hearing. We went to her trial last week in D.C. and it was she did a great job. And the judge really struggled with how to respond to this. You could see him just figuring out what to say, and he rambled for a while and then basically just gave her time served. So that was a good success. The Super Committee didn't have the nerve to do anything. So, and then the housing agreement that President Obama signed, he was all set to give immunity to the big banks for the fraudulent mortgages. I think the Occupy Our Homes movement around the country was putting a spotlight on that. And while the agreement that they came up with was not sufficient, they did remove the provision to give immunity to the big banks. So that was a success, I think, as well. So we're already having success. What do we do from here? We need to see this as a long-term movement. A lot of times we think about, we refer back to the Powell memo that was written in 1971. Lewis Powell, who later became a Supreme Court justice, was a lobbyist in Virginia, and he wrote an internal memo to the U.S. Chamber of Commerce outlining a strategic plan because they really felt like there was a war on the free market. And if you think of what was going on in the late 60s and the early 70s, they were very frightened, and how do they turn this around? And it was about increasing the number of lobbyists, taking over education, taking over media, taking over the courts, creating think tanks like the Cato Institute and the Heritage Foundation, creating ALEC, the American Legislative Exchange Council, came out of that. We need to have a similar long-term strategic plan. And so where we are right now is really building the movement and education. And I think we've got to think that way and not try to get caught up in short-term, like electoral and legislative slides. And I'm not saying don't vote, and I'm not saying don't support candidates that you think are good people, but we have to see if each one of us only has a certain amount of energy and resources, we need to put our energy and resources into things that are going to be effective.
I need to apply for a new library card.
I'll just wait and let her finish.
Please go to the circulation desk now. Cards are not updated or issued after 7:30.
Everybody run? Okay, no. So what I was saying is that each one of us only has a finite amount of resources, monetary, time, energy. Where are you going to put that? And for me, I think most of my resources are going into movement building and education, because that's what's going to bring us, if we can start to shift the power in this country away from corporate power, then things like legislative and electoral solutions become much more possible. So what does that mean? Gene Sharp writes about these 9 pillars that hold up the current power structure. And it's things like the police, the military, civil servants, youth, workers, businesses, religious institutions, did I say the media? NGOs, thank you. And what we try to do is weaken those pillars and draw the people from those pillars to our side. So when we meet with the media, we often say, imagine what it would be like if the reporters, if the journalists owned this media outlet. Like, what would that be like for you? And to a person, they always say, wow, I remember what it used to be like when we had some control over what we wrote, and now, we don't. It's doing things in terms of like workers and businesses, creating worker-owned cooperatives or ESOPs, which are where the employees have a share of ownership. These are all things that start to democratize these institutions and put more of the control in the hands of the people, and that's how we start to weaken the corporate power. And so that's why one of our projects, Kevin and I have, it's called It's Our Economy. We have some cards back there if you want to check it out, and it's just about talking about exciting things that are already happening. There's a participatory budgeting movement in this country where people are organizing so that the people have a say over how capital reserves or how capital budgets are spent at the city level, at their council level. And then there's a big public banking movement. This year is the United Nations Year of the Cooperative. There's 120 million people in the United States already that belong to some sort of a cooperative, like a credit union or a consumer cooperative or a business cooperative. So this is, I think, how we need to think moving forward, is working strategically to both resist those nonviolently, those elements that we need to resist in the society, and kind of build this culture of resistance. Stop cooperating, stop being obedient all the time to the system, and then also building these alternative models that we want to see going forward. So I think I'll leave it there, and then I'm happy to answer your questions. I kind of got a little off single payer, but I'm happy to go back there. And actually, I didn't talk about what's happening in Vermont, but I'll be happy if you're interested to talk about kind of what's happening at the state level with single payer. So thanks.
Talk about Vermont.
Yes, great. So Vermont is a really interesting model and something that we're replicating in our home state, Maryland, and other states are doing it too. When Vermont saw federal reform coming, health reform, they ignored it, and instead they focused on building a grassroots movement in the state with the basis of healthcare as a human right. Healthcare as a human right is defined by 5 principles. It's universal, it's equitable, it's accountable, transparent, and it's participatory, where people have some input into the health system. And those were the criteria that they used. They got a bill passed that required the state to do a study to look at 3 different ways to achieve these 5 goals. And they were able to push to get William Shao, who designed the single-payer system in Taiwan, to be one of the people that worked on designing those systems. So it came from the grassroots. It was just a grassroots organizing strategy. They had a policy committee that was made up of people that are affected by the lack of a healthcare system and who were in that state house. Now, Vermont's a unique case. They have 600,000 people in the state. So it's not quite an organizing challenge like you would have in a bigger state, but and they tend to have somewhat of a progressive leaning, but they were in that State House constantly, watching what was going on, providing input to what was going on, and in the end they did get a bill passed. It has been called a single-payer bill. The actual bill is not a single-payer bill yet. It has the potential. I think they've gone as far as they could at the state level because there's certain kind of obstacles that we run into at the state level. For one thing, to be able to put your Medicaid and Medicare populations into this single-payer pool, you have to get a federal waiver. 42% of people in the state of Vermont are in either Medicaid or Medicare. So without that waiver, you're leaving out a pretty big chunk of people. The other obstacle at the federal level is something called ERISA, the Employer Retirement Income Securities Act. Yeah, and basically that says that you can't. Isn't it nice to have my prompter in the audience? What that basically says is that you can't mandate an employer like what benefits an employer is supposed to provide. So big groups like IBM that self-insure their employees, you can't tell them that they can't do that. So that leaves them out of the pool. But it does create kind of this public health program called Green Mountain Care. And I understand that's getting ready to kick in pretty soon. And they're going to keep pushing it.